I'm Dr. Stephen Davidson, the Sexual Integrity Coach. Today, I'm going to follow up on a previous video where I talked about the difference between a sex therapist and a sex addiction therapist. I told you then that sex addiction theory is controversial, and I want to explore the concept of sex addiction a little deeper to help you understand the basis of this controversy. Before I jump into that, I want to encourage you to subscribe to this channel. It's my intent to provide you with science-based sexuality education that you likely have not had anywhere else in your life. When you subscribe, it helps me reach more people. This is a free resource for individuals and couples who are navigating sex and relationships. So why is the concept of sex addiction controversial? Lots of people identify as sex addicts. Some therapists specialize in treating sex addiction. There are books and treatment centers that talk about sex addiction theory and use sex addiction concepts in interventions with their patients. The news is full of stories of people behaving badly when it comes to sex. If these people aren't sex addicts, then what are they? Early in my career, I believed strongly in sex addiction theory. It made sense when I listened to clients talk about having sexual thoughts and desires that they couldn't control. When people talked about engaging in sex and then feeling ashamed afterward, it sounded like the same thing we hear from alcoholics and other substance addicts. These people truly seem to be powerless over their sexuality, and their lives showed signs of unmanageability. I've given presentations on sex addiction theory and counseled many men and a few women who believed they were sex addicts. As I moved deeper into this theory and model of treatment, I began to discover more and more things that didn't add up, and some aspects of the sex addiction model were in direct conflict with my professional ethics. I observed that relapse rates were high, and that with each relapse, clients were falling deeper into hopelessness and despair. I observed as some colleagues who were sex addiction therapists began to surrender their sex addiction therapy certification and strongly denounce the theory they once believed in so passionately. My own certifying professional sex therapy organization even issued a policy statement denouncing sex addiction theory. These things, along with my own clinical observations, caused me to question my approach to working with clients who identify as sex addicts. It was the impetus for my book, Sexual Integrity: Finding the Courage to Be Yourself. The U.S. has a long history of demonizing and pathologizing sexuality. Even the American Psychiatric Association has evolved further and further away from being judgmental about sexual behavior and taking an increasingly more scientific approach to understanding sexuality. Satiricus, nymphomania, Don Juanism are just a few terms historically used by the mental health profession to label men and women whose sexual behavior fell outside cultural norms. A nymphomaniac was basically a woman who enjoyed sex. Satiricus and Don Juanism were labels given men who enjoyed multiple sexual partners. These labels have fallen away as serious clinical terminology, but some mental health professionals have attempted to replace them with terms that sound more clinical but are ultimately still influenced by sexually oppressive cultural norms. Sex addiction, sexaholism, hypersexual disorder, sexual impulse control disorder have all been proposed as clinical labels for those whose behavior falls outside the heterosexual, cisgender, Judeo-Christian expectations about sexual expression. Sex addiction and its variations, such as love addiction, sexaholism, and pornography addiction, have never been validated as legitimate diagnoses by the American Psychiatric Association. Sexual compulsive behavior disorder is a diagnosis recognized by the World Health Organization in 2018, but the description and criteria are carefully worded to avoid some of the judgmental overtones of the sex addiction theory. Sex addiction theory is controversial scientifically because it overlooks the innate drive humans have to engage in sex. It pretends that all humans are naturally monogamous, cisgender heterosexuals who only want to engage in vaginal intercourse for the purpose of having babies and making love. Human sexuality is far more complex than this. We are not innately monogamous. You might choose to be monogamous in your relationship, and that's absolutely fine, but there are actions you must take to maintain that monogamy because it doesn't come naturally for most humans. When treating addictions, our goal is to help the client achieve and maintain sobriety. Sobriety includes abstinence from the drug of choice. Recovering alcoholics abstain from using alcohol in any form. They don't simply cut back or swap bourbon for beer. They stop using alcohol completely. Opioid addicts don't claim sobriety by simply taking a smaller dose. Gamblers don't trade blackjack for the slot machines. They quit completely. Abstinence is an important piece of getting sober and staying sober. Those who identify as sex addicts don't have a clear definition of sobriety. They either define it very broadly or very narrowly. Most define sobriety based on which sexual behaviors they judge to be unhealthy in their own life. It's left up to each individual to define their own sobriety. These are the behaviors they abstain from, while there are other sexual behaviors they permit themselves to enjoy. Well, this is what most of us do anyway. Most of us have limits, boundaries, things we don't do sexually because we don't enjoy it or we don't think it's worth the risk. So either we are all sex addicts defining our sobriety, or those who identify as recovering sex addicts are simply learning how to set some limits the rest of us have been setting all along. The sexaholic is a very specific kind of sex addict who defines sobriety as no masturbation, no sex with anyone other than a person of the opposite sex to whom you are legally married, and ultimately, no lustful thoughts. If you are gay, lesbian, trans, or even a cisgender single straight guy living with your girlfriend, you are automatically disqualified. How can it be that some addictions like alcohol or gambling require complete abstinence, but sex addiction doesn't? If sex addiction is legitimate, then why isn't there a clear one-size-fits-all definition of sobriety? Why is sobriety defined the same for both gay and straight alcoholics, but defined differently for gay and straight sexaholics? Why do straight male sexaholics get to have sex with their wives and claim sobriety, but lesbian sexaholics can't have sex with their wives and claim sobriety? Is this science or is it something else? What exactly is sexahol? Like the term workaholic, which you rarely hear anymore, sexaholic is a made-up term with no science to back it up. When we have sexual integrity, we stop hiding and suppressing our sexual nature. We surrender our shame about our sexuality. We stop trying to live up to cultural ideals rooted in religious dogma, and we get increasingly honest and transparent with others. We become sexually authentic. We enjoy our sexuality in ways that are true to ourselves, honest and respectful of our partners, and in accordance with the biological and psychological realities of humanity. When I stopped believing in sex addiction theory, I still needed to help my clients who believed they were addicted to sex. I posed the question earlier, if they're not sex addicts, what are they? I state in my book that sex addiction is a big bucket, and we have thrown a lot of things in it that we already know as something else. Most of these people are individuals carrying tremendous shame about their bodies and their sexuality. Some are sex abuse survivors. Some have grown up in rigid, conservative environments where they were verbally or emotionally abused for any expression of their sexuality. Some are in sad marriages or relationships where they are erotically and intimately disconnected from their spouses or partners. And some are sex offenders, voyeurs, exhibitionists. Some are dealing with paraphilias, harmless kinks or fetishes that are often quite common, but for which they have never integrated into their erotic relationship with their partners. They are individuals who have compartmentalized their sexuality, dissociated from it, splitting it off like an alter ego. They might even talk about it like it's another person entirely. Throwing them all into one bucket and labeling it with a made-up name like sexahol is a simplistic approach to diagnosing and treating all things related to sex. In my book, I highlight the fact that comprehensive sexuality education is not allowed in most parts of the U.S., even colleges and graduate programs training healthcare providers. Most healthcare providers have never taken a single course in human sexuality because it was never offered to them in their training. Unfortunately, sexologists have been oppressed in our efforts to raise awareness. States across the U.S. are currently banning books, eliminating social and educational programs addressing sexuality, and even making it illegal for healthcare providers to discuss viable treatments or deliver those treatments to their patients. Labeling sexuality as a mental illness is consistent with religious and political trends aimed at minimizing social and sexual freedoms. If you are someone who identifies as a sexual addict and the concepts of sex addiction theory are helping you feel happier and more in control of your own life, then stick with it. You have a right to choose what approach you take to finding peace in your life. Take what you can use from the sex addiction model that helps you live your best life. Sex addiction therapists are trained in addiction theory and are a good resource for those who view their sexuality through the lens of addiction. The theory is here to stay, and it appeals to many who are seeking ways to repress thoughts and desires they judge to be unacceptable in their life. If the sex addiction model has not helped you feel better about yourself and you've not been able to adhere to the sobriety definition you chose, you might benefit from a consultation with a sex therapist who will approach your case from a different perspective. Ultimately, it's your life. You are the only one who will ever be living it, and you get to make the choices that are right for you. There is so much more I could have shared today that I will likely cover in the future as it relates to the ongoing debate about sex addiction theory. I'm Dr. Stephen Davidson, the Sexual Integrity Coach. Please subscribe to this channel for more sex and relationship education topics. You can leave comments below, as well as your request about other subjects you want me to cover. I hope you will check out both of my books, Sexual Integrity, Finding the Courage to Be Yourself, as well as Peaceful Mind, Peaceful Life, the Guidebook to Happiness. You'll find links for them on my website at sexualintegritycoach.com.